So we're going to concentrate on the base of skull. So start by drawing the outline of a skull shape. It doesn't all have to be perfect drawing in these drawings. They're just really to help you learn to know where things are in relation to each other, and to make it easier for you to learn, because anatomy is notoriously difficult to learn. So next you're going to draw the different areas. So you have your frontal bone, you have your ethmoidal bone, you have sphenoid, you have temporal, parietal and occipital, and then we have the sella turcica, and we also have foramen magnum. Foramen magnum will have some things passing through it, which we'll go over shortly. So we also need to draw in kind of some lines to represent the bone, so the different shapes. So next, the bit we're interested in is what the foramen of the base of skull are. So we'll start up here. This is the cribriform plate. So the cribriform plate has cranial nerve 1 pass through it, the olfactory nerve. Next, we're going to draw the optic canal. So the optic canal has cranial nerve 2. And then we've got the superior orbital fissure, which has cranial nerves 3, oculomotor, 4, trochlear, 6, abducens, and V1, part of the trigeminal nerve. So as you work your way back, you can then draw 4 more circles. So you have a circle, an oval, a small circle, and then kind of a funny shaped hole. So we have foramen rotundum. This has the branch of V2, trigeminal, the second branch. Then we have foramen ovale, which has the branch of V3, part of the trigeminal nerve. We have foramen spinosum, which has the middle meningeal artery. And then we have foramen lacerum, which has the meningeal branch of the pharyngeal artery. And then when you look at it as the third section, we're looking at is like the back section. So you can draw 3 more circles. So you have your internal acoustic meatus. This will carry, acoustic is another word for like sound. So you think of it as it's going to carry the sound, and often you have the facial near it. So you have the facial nerve 7 and the vestibulocochlear nerve 8. And then we have the jugular foramen. So the jugular foramen has cranial nerves 9, glossopharyngeal, 10, vagus, and it also has a part of 11, and then it has the internal jugular vein as well. And then we have the hypoglossal, that's cranial nerve 12. And the foramen magnum, which we've already mentioned, has the spinal part of 11. And then it also has the vertebral arteries and the spinal cord. Not in red. Do that in black.